It is Medical Monday, and that means a house call from KRDO News Channel 13's Dr. John Torres.
And today, Dr. John is highlighting brain aneurysms, homework for students, and the surprising benefits of vitamin D.
A New York television reporter died Friday from a sudden brain aneurysm. Lisa Colagrassi is one of an estimated 30,000 people in the United States who have had brain aneurysms that rupture every year. About 40% of cases are fatal. Another 25% die within 6 months due to complications. Now, most people who have a brain aneurysm that ruptures have absolutely no predisposing factors. It just sort of happens out of the blue. An aneurysm occurs when the walls of a blood vessel become weak and they start to balloon outwards. If that blood vessel ruptures, an hemorrhage can occur, and that spills blood into the surrounding brain tissue. That can be deadly. In rare cases, individuals with large aneurysms could have symptoms. We're talking pain above the eyes, vision changes, paralysis on one side of the face or the other, similar to stroke-type symptoms. And with a sudden hemorrhage, they will have severe headaches, vomiting, and maybe even a loss of consciousness. If you find yourself having any of these symptoms, you need to call 911 right away. Now, switching gears, when it comes to math and science, homework sometimes doesn't always mean more is better. As a matter of fact, the American Psychological Association published a study on adolescence and homework. It surveyed nearly 8,000 students and found just 1 hour of homework is reasonable and effective. As a matter of fact, homework is important to learn study habits and discipline. Students that had it scored nearly 50 points higher on standardized tests. Those who did their math homework on their own scored 55 points higher than those who asked for frequent or constant help. The bottom line, assigning more than 70 minutes of homework per day doesn't seem to be very efficient and certainly doesn't seem to help students learn any more. And another new study shows vitamin D supplements can help or prevent low-grade prostate cancer from progressing. The study's lead researcher says vitamin D decreases inflammation. That drives cancer. Now, for the study, researchers asked about 37 men to undergo prostate surgery to either take vitamin D or a placebo for 60 days before the operation. When the prostate gland was examined after the surgery, researchers found that many who received vitamin D had improvements in their prostate tumors, while the tumors in the placebo group remained the same or actually ended up getting worse. Now, despite these results, researchers admit the study was small and results from a larger trial aren't expected for several years. I'm Dr. John Torres, and that's your Medical Monday.